Hello, I'm Hussain. I'm a consultant interventional cardiologist. I work at the Royal Berkshire Hospital, and today I'll be talking about coronary artery disease. Coronary artery disease essentially is narrowed arteries that supply blood to the heart, and there are several factors that can lead to this, things such as high blood pressure, high cholesterol, diabetes, smoking, or even a family history. When it does occur, it can manifest in certain ways. For example, patients can often complain of chest pain. It might feel like a heaviness or tightness in the chest, predictably with activity and less so with rest. It can also affect patients with symptoms such as feeling short of breath or even a lack of exercise capacity. The way we investigate coronary artery disease is initially with a history and examination face to face and a routine 12-lead ECG, which is when we stick some electrodes onto your skin to have a look at the heartbeat and if there's any damage or any signs of any problem in that respect. But more so than that, we undertake routine echocardiography, which is essentially an ultrasound of the heart, very similar to what a pregnant woman would have looking for the baby. It's a very non-invasive test, takes about 15 to 20 minutes. It looks at the pumping of the heart, the valves in the heart, and the chamber sizes in the heart. The specific test looking at the coronary arteries is usually by a cardiac CT. This involves coming into hospital, having a small needle in the arm, and then contrast is injected into the arm at the same time as being in a CT scanner, and we can easily see the coronary arteries to determine if they are narrowed, normal, or blocked. Once the investigations have been carried out, it's then easy to determine what treatment is required. This may be simple things such as risk factor modification, for example, controlling high blood pressure or cholesterol, or certain medications may be required to remove or reduce the strain from the heart to help alleviate some of the symptoms that patients typically present with. In certain instances, invasive coronary angiography is required. This is a day case procedure which I routinely perform, usually through the wrist. This involves local anesthetic and small amount of sedation. Small tubes are passed up from the arm down towards the heart. In doing so, we can inject in contrast, which is basically a dye, and the X-ray machine takes pictures. This is the gold standard way of assessing the coronary arteries to determine if they are narrowed, normal, or blocked. Once the images have been obtained from the coronary angiogram, it's easy for me to then determine if any additional tests need to be performed. For example, if an artery is a little bit narrowed, but it's not entirely clear if it's of any significance, I can put a special wire down the artery that measures the flow of blood before and after the narrowed segment, and it tells me if it's positive or negative. That can help me determine whether stenting is required or not. If stenting is required, I then routinely normally go ahead and perform it at the same sitting.